6 warning signs of Mgen most people don't know about. There is a sexually transmitted infection spreading silently across the globe right now, and chances are you have never even heard of it. It is called Mycoplasma genitalium, or Mgen for short. Here is what makes it terrifying. It can live inside your body for months, sometimes years. No symptoms, no warning signs, nothing. You feel completely fine, and the entire time, you are unknowingly passing it on to every sexual partner you have. But when it does decide to show up, it mimics chlamydia. It mimics gonorrhea. It gets misdiagnosed over and over again. And while doctors chase the wrong infection, Mgen is quietly destroying your reproductive system from the inside out. In women, it can lead to pelvic inflammatory disease, scarring of the fallopian tubes, and even infertility. In men, it causes persistent urethritis that refuses to go away no matter how many rounds of antibiotics you take. And to make matters worse, this bacteria is rapidly becoming resistant to the very drugs designed to kill it. So today, we are going to break down 6 specific signs and symptoms of Mycoplasma genitalium that you absolutely need to know. Whether you are a man or a woman, these are the red flags your body might be sending you right now. Red flags that most people completely ignore. Stay with me. This information could genuinely protect your health and your future fertility. Let us get into it. Disclaimer: this information is for educational purposes only and is not medical advice. If you think you may have Mycoplasma genitalium or another STI, consult a healthcare professional for proper testing and treatment. All information presented has been thoroughly researched and verified. You can find source links in the video description. What is Mycoplasma genitalium? Before we dive into the symptoms, you need to understand exactly what we are dealing with here. Because Mgen is not your typical bacteria. Mycoplasma genitalium is one of the smallest known self-replicating organisms on the planet. It was first isolated in 1981 from the urethral specimens of 2 men who had non-gonococcal urethritis. But here is the thing. It took decades for the medical community to truly recognize it as a major sexually transmitted pathogen. The delay happened because Mycoplasma genitalium is very hard to grow in labs. It takes weeks or even months, unlike other bacteria that grow quickly. This made it difficult to detect and study for a long time. What Mgen does is infect the epithelial cells lining your urogenital tract. Think of the urethra in men, the cervix and urethra in women. It attaches to these cells using a specialized tip structure and essentially burrows into the tissue, triggering an inflammatory immune response. And that inflammation? That is where all the damage comes from. The infection is transmitted through direct genital-to-genital contact during sexual intercourse. It is not spread through casual contact, kissing, or sharing towels. This is strictly a sexually transmitted organism. Now, one of the most critical things to understand is that Mgen has a variable incubation period. Symptoms, if they appear at all, typically show up 1 to 3 weeks after exposure. But latency periods can stretch much longer, which is exactly why so many people have no idea they are infected. 1. Urethral discharge. Let us start with the first and most recognizable symptom, particularly in men. Urethral discharge. If you are a man infected with Mgen, the most common clinical presentation is non-gonococcal urethritis, or NGU. And the hallmark sign of NGU is discharge from the tip of the penis. Now, this is not the dramatic, thick, pus-like discharge you might associate with gonorrhea. Mgen discharge tends to be more subtle. It is often clear or slightly cloudy, sometimes whitish. In more progressed cases, it may take on a yellowish or yellow-green tint and become slightly thicker, approaching a mucopurulent consistency. Here is what catches most men off guard. The discharge might only be noticeable in the morning. You wake up, and there is a small amount of fluid at the urethral opening. You wipe it away, go about your day, and do not think about it again. But that morning discharge is your body sounding an alarm. The discharge is a direct result of inflammation inside the urethra. Mgen has attached to the urethral lining, and your immune system is responding. White blood cells are flooding the area, creating that fluid you are seeing. Many men dismiss this as a minor irritation. They assume it is nothing, or they convince themselves it is related to something else entirely. But persistent or recurring urethral discharge, even if it is mild, should never be ignored. This is especially true if you have recently had a new sexual partner. That timeline matters. If discharge appears within 1 to 5 weeks after a new sexual encounter, Mgen should be on the radar immediately. 2. Burning during urination, dysuria. The second major symptom is dysuria, and if you have ever experienced it, you know exactly how uncomfortable it is. Dysuria is the medical term for a burning, stinging, or painful sensation during urination. With Mycoplasma genitalium, this symptom affects both men and women, though the underlying mechanism is slightly different in each. In men, the burning comes directly from the inflamed urethra. As urine passes over the irritated, swollen urethral tissue, it triggers a sharp, stinging pain. Some men describe it as a feeling of passing glass. Others say it is a persistent low-grade burn that lingers even after they finish urinating. The intensity varies, but the pattern is consistent. It gets worse over time if left untreated. In women, dysuria from Mgen can originate from urethral inflammation or from the proximity of cervical infection to the urinary tract. This is one reason Mgen is so frequently misdiagnosed as a urinary tract infection in women. The burning feels identical. A woman goes to her doctor, describes painful urination, and walks out with a course of antibiotics for a UTI. The antibiotics do nothing against Mgen. The symptoms may briefly improve and then come roaring back. Here is the critical detail. If you are experiencing recurring dysuria and your urine cultures keep coming back negative for a standard UTI, that is a massive red flag. It is telling you that something else is going on, something that standard urine culture panels are not designed to catch. Mgen requires a nucleic acid amplification test, a NAT, to be properly detected. Standard cultures will miss it entirely. 3. Abnormal vaginal discharge and cervicitis. This third sign is specific to women, and it is one of the most commonly overlooked. When Mycoplasma genitalium infects the cervix, it causes a condition called mucopurulent cervicitis. That is a clinical way of saying the cervix becomes inflamed and begins producing abnormal discharge. What does this discharge look like? It varies. Some women notice a slight increase in vaginal discharge that seems thinner or more watery than usual. Others see a change in color. It may shift to a yellowish or grayish tone. In some cases, the discharge develops an unusual odor, though this is not always present. The tricky part is that vaginal discharge is a normal physiological process. Every woman experiences it. So when Mgen causes subtle changes, it is easy to brush off. You might attribute it to your menstrual cycle, a change in diet, a new soap, or stress. The change is just gradual enough that you do not recognize it as pathological. But here is what is happening internally. Mgen has colonized the cervical epithelium. The immune response at the cervix produces inflammatory exudate. That is the abnormal discharge you are seeing. If a clinician were to examine the cervix during this active infection, they would likely observe redness, swelling, and a visible mucopurulent secretion at the cervical os. This is not a cosmetic concern. Cervicitis caused by Mgen is your body telling you that active infection and tissue damage are occurring at the gateway to your upper reproductive tract. If the infection ascends past the cervix into the uterus and fallopian tubes, the consequences become significantly more serious. We will talk about those later. 4. Postcoital bleeding and intermenstrual spotting. Postcoital bleeding means bleeding after sexual intercourse. Intermenstrual bleeding means spotting or bleeding between your regular menstrual periods. Both are strongly associated with Mycoplasma genitalium infection, and both signal that the cervical tissue is in trouble. Here is the mechanism. When Mgen causes cervicitis, the cervical tissue becomes inflamed, engorged with blood, and fragile. The surface of the cervix is essentially raw and irritated. During sexual intercourse, physical contact with this inflamed cervix causes small blood vessels to rupture. The result is bleeding, sometimes light pink spotting, sometimes frank red blood that appears immediately after intercourse or within a few hours. Many women panic when this happens. Their minds immediately jump to cervical cancer. And while postcoital bleeding absolutely warrants a thorough medical evaluation to rule out malignancy, in younger sexually active women, infection is a far more common cause. Mgen specifically should be on the differential. The intermenstrual spotting follows a similar logic. The ongoing cervical inflammation creates a fragile tissue environment that bleeds spontaneously, unrelated to your menstrual cycle. You might notice light brown or pink spotting on your underwear mid-cycle with no obvious explanation. If you are a woman experiencing unexplained bleeding between periods or after sex, and your pap smear comes back normal, and you have tested negative for chlamydia and gonorrhea, do not stop investigating. Ask your healthcare provider specifically about Mycoplasma genitalium testing. This is not a bacterium that is included in standard STI panels. You have to specifically request the test. 5. Pelvic pain and pain during sex. The fifth sign involves pain, and specifically, the kind of deep, persistent pelvic pain that tells you something is happening well beyond the surface. In women, lower abdominal or pelvic pain associated with Mgen is a warning that the infection has likely ascended from the cervix into the upper reproductive tract. We are now talking about the uterus, the fallopian tubes, and potentially the ovaries. This ascending infection is the pathway to pelvic inflammatory disease, PID. The pain can present in different ways. Some women describe a dull, constant ache in the lower abdomen that worsens during menstruation. Others experience sharp, stabbing pains on one or both sides of the pelvis. The pain may intensify during physical activity, deep penetration during intercourse, or even during bowel movements. Dyspareunia, pain during sexual intercourse, deserves special attention here. When Mgen causes deep cervical or endometrial inflammation, penetration can trigger significant discomfort or outright pain. This is not the same as superficial pain at the vaginal entrance. This is a deep, internal pain that women often describe as a pressure or sharp ache during and after intercourse. In men, pelvic pain takes a different form. Mgen can cause epididymitis, a painful infection and swelling of the epididymis, the coiled tube behind each testicle that stores and carries sperm. This presents as a gradual onset of pain and heaviness in one testicle, sometimes accompanied by visible swelling and warmth. Epididymitis from Mgen is a clinical emergency when it comes to male fertility. Chronic or severe epididymitis can damage. 6. Rectal symptoms and proctitis. The sixth sign is one that rarely gets discussed, yet it affects a significant population. Rectal symptoms, specifically Mgen-induced proctitis. Proctitis is inflammation of the lining of the rectum. In the context of Mycoplasma genitalium, this occurs primarily through receptive anal intercourse. The symptoms of Mgen proctitis are distinct and uncomfortable. Rectal pain is often the first complaint, a persistent soreness or burning sensation in and around the anus. This is followed by rectal discharge, which may be mucoid or mucopurulent in nature. Some individuals report visible blood in the discharge or on toilet paper after wiping. There is also a frequent sensation of tenesmus, the feeling that you need to have a bowel movement even when the rectum is empty. It is a deeply uncomfortable urgency that does not resolve, and it significantly affects quality of life. Here is where the diagnostic challenge becomes critical. Mgen proctitis presents almost identically to chlamydial proctitis and gonococcal proctitis. Without specific testing, clinicians will typically treat for chlamydia or gonorrhea first. If those treatments fail and symptoms persist, Mgen should be investigated. But there is a complication. Rectal Mgen is even more difficult to eradicate than urogenital Mgen. Antibiotic penetration into rectal tissue is variable, and Mgen's increasing resistance to macrolide antibiotics, specifically azithromycin, means that first-line treatment frequently fails. If you are experiencing persistent rectal symptoms following anal sexual contact and standard STI treatments are not resolving the issue, bring up Mgen with your provider. Specific NAAT testing on a rectal swab is the only reliable way to confirm or rule out this infection. Subscribe to the Human Health YouTube channel for more insights. If you found this content helpful, please like, share, and comment below.